Every year in India, more than 30,000 people lose their lives by drowning. Of these, one-third, that is more than 10,000, are children. This is a serious problem. To avoid drowning accidents, it is very important to learn how to swim, follow safety rules in water bodies, and supervise children. Today's topic: First aid for drowning. What is drowning? Drowning means the stopping of breath caused by the mouth and nose being under the surface of water or any other liquid. If breathing stops, the brain and heart do not receive oxygen and they stop working. A person can only survive for a few minutes without breathing. This is why drowning is a serious emergency, and only immediate proper first aid can save a life. How to give first aid in case of drowning? The first and most important thing is that you must not put yourself in danger to rescue or pull out the drowning person. Enter the water only if you are trained and know how to rescue or pull out a drowning person. The person is in shock after coming out of the water. Sometimes their pulse is not detectable. They have difficulty breathing or they breathe abnormally.
Are you okay? Are you okay? Are you okay? Are you okay? Are you okay?
Common symptoms of drowning are coughing, altered consciousness, such as difficulty in understanding things. In a drowning incident, there can be two possible situations. First, the person is conscious. Second, the person is unconscious. Give first aid like this when the person is conscious, that is, in the first situation. Assess the situation quickly. What is the reaction or response? Check the pulse and breathing. Cover the person with dry clothes. Arrange for hospital transportation, as a medical examination by a doctor is necessary. Second situation, that is, the person is unconscious, is more serious.
Are you okay?
Lay the person on their back and assess their condition. If the person is not responsive, then call to take them to the hospital and let them know that it is a drowning emergency situation. After this, tilt the head backwards like this to open the windpipe. Bring your ear close to the mouth to check for breathing. Keep an eye on the chest and stomach. Is it moving along with the breath? If the person is breathing, then place the person in the recovery position. Cover with dry clothes. Keep monitoring their condition until help arrives. If the person is not breathing after the drowning, then start CPR immediately while waiting for the ambulance to arrive. To perform CPR, place your palms in the center of the chest and push downwards lightly. Your goal is to keep the person breathing. If you know how to perform mouth-to-mouth resuscitation, then after 30 chest compressions, give mouth-to-mouth twice. Again, 30 compressions, 2 mouth-to-mouth. Keep doing this till the help arrives or the person regains consciousness or becomes responsive. Response means coughing, opening eyes, movements in body parts, and regaining consciousness. Stop CPR if the person starts breathing normally. Remember the correct first aid in case of drowning. If the person is conscious and breathing properly, take them to the hospital. If the person is unconscious but breathing, call for an ambulance and place them in the recovery position. If the person is unconscious and not breathing, call for an ambulance and start CPR immediately. One more important thing. Do not try to expel the water by pressing the stomach after drowning. This can be dangerous for the victim. Prevention of accidents is better. For safety, keep in mind, always be cautious around water. Learn first aid. Stay alert.